Good morning, members of the media and our following on Facebook Live. Today we have with us John Woodrich, the president and CEO of Bryan Medical Center, and Jeff DeBoer, who is our manager of environmental services with our robot Frost. It's a bug-eating robot that we've had in place here at Bryan a lot of times, and Jeff's going to share an innovative new way to use that to extend the use of our PPE and a few other things. Before we get started, a couple of donation things to address and then also answer a question. We've received a lot of messages through phone, email, you name it, and they're asking how are we doing. And I think one way to answer that is we're doing well. People at Bryan, we still have our jobs. It's a privilege to care for our friends and our neighbors and our community in only a way we can right now at this point in time. And the community support has been so incredible, from the stories written to the gifts in. But honestly, another way to answer it is it's hard. It's very busy and it's very quiet. Our bustling public spaces aren't so bustling now, and we wish it was. More specifically, we've witnessed how visitor restrictions have altered precious end-of-life situations for families. We've reorganized our business model and our care model overnight with remote working and repurposing of our clinical staff. When our masks and gowns come off, or when some of us leave after our beautiful Nebraska spring sunsets have occurred, we're a lot like you. We have spouses and partners who have lost jobs or income. We have kids from preschool to college that are learning to work or study at home, going a little stir crazy. We have elderly loved ones we can't see. We don't know when we'll see them again. So, hello, Grandpa Don and Clinton. I hear the surgery went well and they're breaking your porch swing out for the spring. We have friends and family members being treated for COVID-19 around the world. We have friends and family members that live in places like New York, Seattle, Chicago, South Florida, where we're seeing all of the tough images. We have members of our team that have had loved ones pass away without funerals. So we're about like all of you right now. Fortunate to have our jobs, wonderful place to work, and your support is so meaningful. The stories you're writing are so helpful in getting the word out and giving us a fighting chance with it. And with that, I want to go into some of our recent very inspiring gifts. Previously, we've announced many of them. We've received even more gloves. We have now received over 115,000 gloves. Yesterday, we showed you the mask from Innovation Studio. We got 194 new masks from Myron Coleman. His wife is an employee, a nurse here, took his 3D printer and made them. First United Church of Waverly gave us 270 N95 masks that were left over from some of their past relief efforts yesterday. And the UNL Department of Natural Resources made a large donation of gloves, bunny suits, shoe covers, and hand sanitizer left over from research grants. Countless gift cards for our staff. Honestly, thank you. Doesn't seem like it's adequate words, but they're truly the best words I have right now. Thanks for all you're doing. I know many of you have been impacted through income or loss of jobs. If you know of people looking for employment, please have them go to bryanhealth.com. Click careers in the top corner. Competitive pay, great benefits, wonderful caring people doing very important work, and maybe it'll help somebody you know. So again, we're doing well. It's hard. We couldn't be doing it without you. Everybody in Nebraska is standing up and representing. Our numbers, midnight census is 344, pretty stable between the 350 and 390. Our Bryan Easy Visit screening questionnaires, we've had 7,500 of them completed, with 1,825 resulting in easy visits, and 821 have used the COVID-19 promo code. Numbers tested to date at Bryan Medical Center, 114. 74 of those are negative. So far, total positives at Bryan Medical Center are 0. Thank goodness for that. We have pending results on 14, and of those 15 are inpatients. At our drive-through clinic, we have tested 353 for the COVID-19 with the COVID-19 test, with 3 of those positive and 243 still pending. The testing capabilities currently in Nebraska and our country are extraordinarily frustrating for us, for our patients, and I know for all of you, but that's what it is right now. With maybe a brighter look on things, I'm going to ask Jeff DeBoer, our Manager of Environmental Services, to come forward to talk about the work of our staff here and what they're doing to keep our facility clean and free of germs and safe. Jeff, come on up.
Good morning, Jeff DeBoer, Environmental Services Manager here at Bryan. Excited this morning to be able to talk to you about the things that our environmental services team are doing here at Bryan to keep the hospital clean, to keep our patients safe, to keep our staff safe. One of the things that's kind of a focal point at this juncture is our germ zapping robot by Xenex. What we're able to do with it is we're in the process of working with our IP team and also our facilities group to build racks and to be able to disinfect our mask in an effort to conserve our supplies and resources. This process, hoping to have it operationalized here by the end of the week, would allow us to disinfect between 300 and 400 masks per hour, which is really exciting. We do that by collecting the mask and then on these racks that we're in the process of constructing to be able to hang them, have them centered around the robot, then to activate the robot, which puts out pulsed UV light, and then able to move those out and bring in another batch. And like I said, at full operation will be between 300 and 400 lights. In addition, we continue to take care of all the patients that are here, to take care of our transfer and discharge rooms. And really for us, the process has remained very consistent. The cleaning that we do in those areas, from patient rooms to procedural areas to surgical suites, continues, and we're able to do so just like we've done before. Really, it hasn't required a great change. I know there's a lot of attention on the COVID-19 virus, but here at Bryan, we deal with like viruses and many other things that are even a little more challenging and difficult to take care of. And so our processes are really built around being able to do this 365 days a year. And so from cleaning the rooms, from the disinfectants that we use, to the processes, thankfully we've got something that really addresses all of this, including the coronavirus. Staff are doing well. I'm really proud of our team. Obviously, being on the front line and going in these rooms and these areas, certainly with the coverage and the focus could be scary. And really, our team just continues to focus on the fact that it's really business as usual. It's really doing what you've been trained to do. And any time that we do have any process that we need to look at, we're lucky that we've got 3 instructors that are part of our team that will work with our group, work with the individuals, and really to ensure that they've got the training that's necessary to do that job, to make sure that we're following all the PPE guidelines that are put forth, and really to, again, just continue to do our job and knock that work out. So, yeah, good stuff.
Thanks. I'm John Woodrich, CEO of Bryan Medical Center, and I want to do a little follow-up from what Bob gave you as numbers. So we have tested 353 individuals for COVID testing with those 3 positives. We have 107 that came back negative, which is good news. That's up by 67 from what we reported yesterday. So we still do have 243 tests pending. When we do get those results, we contact the primary care physician that was the ordering physician, and then they call those patients back. As soon as we get the results, we notify those physicians. We're trying to get information back to people. We know that these long delays as we're sending these tests out to an outside lab, we're not pleased with either. but it's the situation that we're in today. But we will get those results back as quickly as we receive them. I wanted to cover a change in our visitor policy, and this will go into effect Friday, April the 3rd, that we will restrict visitation to having no visitors for our patients in our facility and clinics. And this is actually through a guideline through the World Health Organization of limiting the number of people. But we do have exceptions to that, and I want to go over those exceptions because there are certain situations where individuals need a support person with them. So patients arriving at our emergency department, we will limit them to having one visitor or person, and that's only if that person is absolutely needed to assist them. Our Bryan family birthplace, we will limit one partner to the person that is delivering. In our NICU area or our postpartum infant area, we will allow two individuals, either the parents or the guardian. For any pediatric or minor, and that is a person 19 years or younger, we will limit that to one parent or guardian. Dependent upon the individual with the special needs, we will let that support person be determined by our administrative manager, which we have one of those around the clock, and that patient's nurse. Same thing with a patient care partner needing teaching instructions to help that person maybe when they're discharged, and that will be determined by the administrative manager as well. Any of our outpatient and clinic patients needing a support person or for transportation, we would limit that to one as well. Probably the most difficult one is when we know that patients are at their end of life care. That will be, the number of visitors at that point in time will be determined by the patient's nurse and the administrative manager. We know those are real unique circumstances and special circumstances, and we will use our best judgment to allow family members to be with those patients. Any other special circumstances, we will just deal with those as they present upon themselves. We really do feel that when a person is in our facility, that if they truly need a support individual, we will make exceptions for that, but we need to truly limit the number of individuals entering our facility. We are still doing temperature checks. We're asking a series of questions to anybody that's coming in, because what you've seen around the country, the last thing we need to do is to have a number of our healthcare providers go down sick. We're trying to do our best to assure that we're keeping our healthcare individuals healthy, but also protecting anybody that walks into our facility. This is a difficult situation, but what are the alternatives that we can offer to you? So if you want to connect with a patient, and that patient happens to be at our Bryan East campus, and you want to call them, the number is 481-1, and then whatever their room number is. On the West campus, 481-9, and whatever their room number is. And if they're in the women's tower, it's 4817, and then just put in the room number as well. We are doing a variety of things for patients that some ways that you could connect with them is through the phone, iPads, tablets, laptops. If a patient does not have one, we have a limited supply that we would give to the patient so they could connect with their loved one, but it would only be for a limited time, because when you have a census of 350 patients, we have to be able to accommodate all the needs there. If people find that they're in the hospital and they don't have a charging device for whatever device they're going to use to communicate, we do have charging cords, and we can get that through our volunteer and customer care, so we'll make sure that people have that equipment that they need. With that, we'll take any questions that may come over the chat. If it is a COVID-19 patient, been diagnosed, we will not allow any visitors in the room. The risk of exposure of that is just too great to have it occur.
We named it Frost because we purchased this robot, this third one, in the year Scott Frost was hired. I can tell you it kills germs at the 94, 95 Husker level of effectiveness, so pretty much kills all germs.
In a standard or typical patient room, we still do our standard clean, and then after our standard cleaning, we would bring the robot in. And our standard room, some of them vary in size, and so it could be just a slight variation. But typical room size, it's about 40 to 45 minute standard clean, and then we bring the robot in, and we have 3 different locations that we set up for a 5-minute cycle. So all in all, roughly about an hour that we commit to each room clean. This is UV light, and really the precautions that we set up is that once we bring the robot into the room, manually activate it, we have a period of time before we are given to exit the room. Really, it's just a matter of it's really the equivalent of looking at the sun. It's not going to necessarily hurt you. We certainly take precautions to make sure that no one's looking directly at it, that the rooms that we're doing, that if we need to have glass covered or curtains pulled, that we do that as well. But really, with the protocol that we have in place, we've got a shut-off mechanism. So if for some reason someone would not see the sign, they'd bypass that. They'd go into the room, and there would be a remote deactivation that would take place. So really a lot of different safety features to ensure that no one's in harm's way. Really, this is in addition to our standard clean. It's still important to do the cleaning, to go through the cleaning process. When you're wiping surfaces down and you're making sure you've got good friction, you're removing that bioburden from the surface. And what the germ zapping robot will do is that when placed correctly and activated, and we run the correct number of cycles, whatever was left, whatever could have been missed or wasn't covered in that standard clean, the UV light will deactivate the DNA of the bacteria and germs and viruses that are on the surface. So again, it doesn't remove that, it just deactivates it, so it makes it where it can't be passed on to the next person that comes in there. The number of rooms that we clean daily varies with census. Discharge and transfers, we could do as many as 10,000 in a month. On all the different areas that we cover. We're all over the hospital, ED, procedural areas, surgical suites, patient rooms, ancillary areas. So it's certainly been very busy the past several years, and at times that number can be as much as 10,000. Again, I want to emphasize that from a cleaning standpoint, the process, the protocols that we have in place, we're dealing with multi-drug resistant organisms. We're dealing with things, spores, things on a regular basis that really require us to always be ready to deal with situations like this. And so we really, the COVID-19 would be an airborne precaution, so that we would make sure that the room sits for an hour before we would go in there to do it. And then once we're in there, again, it's our standard clean, and really we've got to be set up that way, again, to address all the different things that we see throughout the year. Right now we've got 4 robots, 2 on each campus, and we have ordered a couple more. So we'll have 6 here within the next couple weeks. And what we plan to do is we still, obviously we want to be able to implement to disinfect the mask, as I had mentioned, but we also still have responsibilities in other areas and priorities that we need to focus on. And so we'll have, on each campus, we'll have 1 robot set up, 1 room that will be our mask disinfection room. That will allow us to use the other robot to address any other isolation rooms that are necessary, or as we do in the evenings, target our surgical suites as well.